very big misconception about the 46 million people that are uninsured. According to the statistics that I've researched, 28 million of those people have incomes over $50,000 a year, but choose not to have insurance. Another 20% of 10 million, with number that you've referenced, are illegal aliens, which do have access to emergency care. And the other 10 million people, 8 million people, are chronically uninsured either due to low income or because they're between jobs and choose not to have insurance or cannot afford the insurance between those jobs. The question that I have for you is if your health care insurance is going to be similar to what's in the program, would you accept a mandate for all Congress people to be covered under the same care that's being proposed here? And if not, why not?
All right. That's a legitimate question, and the answer is yes. I would be happy to be covered by a mandate, and I would vote for that. In fact, the plan for most people includes the coverage they already have.
They're not covered under Medicaid.
It's only for those who've lost their jobs, lost coverage, don't have care currently, where this new plan is going to provide some access to health care. On the figures that you've just recited, and I'm not in a position to dispute them, but just a couple of things. If you know people who earn $60,000 a year, try buying health care at that income level. I mean, it is over the top, it is expensive. Number two, just a word about those who are here illegally. Not all of them lack health care insurance. If you are employed in a company, you may very well have health care insurance through your employer, even though you don't have the legal right to be employed in this country. So not all of the 10 million are without health care insurance. And just a note on underinsurance. You know, the single biggest cause of personal bankruptcy in the United States is health care. And most of those individuals who are going belly up because the health care had insurance, it just didn't pay for what they had. Another aspect of this plan is to cap out-of-pocket expenses. And I don't know
We should have a healthcare
if
bill
you
on
know
instead of
people as
mortgage.
I do who get cancer. They thought they had insurance until the bills started coming in, and then they had to sell everything and then sometimes go into bankruptcy because the insurance actually wouldn't pay for the care. This would actually cap and prevent that phenomenon from occurring.
Protect the people that are too stupid to protect them.
My name is Melissa Schultz. I just recently moved to Morgan Hill, and my question is, why don't you and the rest of the Democrats in Congress just concentrate on the 46 million people that do not have insurance and leave the 85% of Americans who are happy with their coverage alone? Thinking that this is going to work when they had tried it in Tennessee, they had tried it in Massachusetts. Both of those states are almost completely bankrupt.
That's right.
Hawaii, the president's own state, tried it for 7 months and it was shut down and repealed because it wasn't affordable. How is it going to sustain an entire country? It's not going to work.
Good question.
For the individuals who have health care currently, there really isn't a change.
Not true. Read the law. Read the bill.
There is inadequate coverage where an individual doesn't have care.
Read the freaking
In some
bill.
cases by expanding the Medicaid program. In some cases when the health exchange gets up and running to allow individuals who either have lost their care or employers who don't want to acquire it at an affordable rate. So if you have your health care with your employer now, which is how most people have their health care, it doesn't change that. And
Needs to read the freaking
that's
bill.
how I get mine, and how most of the people do, unless you're on Medicare.
Enrollments after the national health plan starts. So that means anyone turning 18 cannot get on the national health plan. If you lose your plan,
You're forced to the public plan. That's right. You're forced into the public plan.
Thank you, Ms. Lofgren, for being here. I do have one question. I hear a lot of information regarding all of these aspects about for-profit insurance reform. What about nonprofit? I'm a Kaiser client. I buy it. I use it. Kaiser will be impacted by how they have to operate if a bill such as this one passes. They will not be able to do what they do. And Kaiser, that's what we use here. So I'd like to know your take on Kaiser and nonprofits.
Right.
And what about, if this passes, what about places like St. Jude's or the Mayo Clinic? They're nonprofit. What about all the nonprofits that provide medical care? They're gonna be
I just met with Kaiser this week to go through the bill with them, the local Kaiser. And the only issue that they wanted to sort through with me was the Medicare Advantage issue, which in the Medicare Advantage program provides a service for seniors, but, and I think Kaiser is using it appropriately, but in large parts of the country, it is a big ripoff. I mean, there are 17 to 25% profits on the program. There's a lot more money going into the program than services are being received by seniors. So there is a need to reform that. Kaiser wants to make sure that the good guys in the nonprofit world are not adversely impacted, and they promised to get me some language to that effect this week that I can take back to Washington when we reconvene. As for the other nonprofits, I mean, they're not adversely impacted, and in fact, most of them are supporting this effort.
That's not the case. That is absolutely not the case. And when this
not.
bill creates the bureaucracy that it purports to create, then all of these entities will have to answer to those regulations.
That's right.
And they will not be able to do what they do best.
It is true that healthcare insurers, private, for-profit and nonprofit and government, will not be able to discriminate based on pre-existing conditions. That's going to be a rule that's going to go into effect, and it's going to cover everybody. And I haven't heard a complaint from the nonprofits about that. I think it's...
But they can't buy land. It says hospitals cannot expand.
So I would like to know why we're going to insure 20 million illegal immigrants in the U.S. when they're not even supposed to be here.
Go to that section. Go to
The bill specifically prohibits.
That's not true.
That's
That's a lie.
I'm surprised that no one has asked me whether I have read the bill. And actually, I have read the bill.
So have we.
I put it on my
Pull up your
my Kindle,
pull it up.
So because it's a
Pull it up.
very thick bill and it's easier to pull
This one I couldn't find. I couldn't find
And for those of you who would like to see the bill as well as the summary, it is posted on my website, quite accessible
I'm not gonna read her
to anyone
summary.
who wants to read it.
Section 152.
Still.
What about shortage of doctors? It's right there.